Welcome to today's Explainer. In an industry that pumps out literally billions of doses of medication every single year, the margin for error is, well, it's basically zero, right? We talk a ton about the science, we talk about the cutting edge tech, and of course, we talk endlessly about regulations. But today we're unpacking one of the absolutely most crucial, yet kind of underrated competencies in the entire pharmaceutical industry. We're getting right down to the human core of it all. We are talking about quality by integrity. Okay, let's dive into this. The absolute thematic heartbeat of what we're looking at today is perfectly captured in this one phrase: doing the right thing when nobody is watching. In an industry that is completely defined by rigorous standards, the moments that genuinely define our work, they aren't the loud public ones. Nope, they're the quiet, unseen choices you make when you're completely alone with your work. So let's move into section 1, beyond the FDA inspection. We're going to strip away some of those corporate layers here. And this brilliantly illustrates exactly what pharmaceutical integrity means at its ground level core. There's this persistent myth out there, right? This idea that integrity is something you just put on display. Like it's a show you perform when the FDA inspector walks into the facility or when your manager is standing right over your shoulder holding a clipboard. But the reality? True integrity is what's demonstrated every single day when absolutely no one is checking. I mean, it's the difference between having a pristine facility during a scheduled audit and meticulously swabbing out a massive, tedious bioreactor tank on a random Tuesday night shift when you're just totally exhausted and the stakes feel completely internal. Moving right along to section 2, anatomy of everyday integrity. Let's get specific. So, what does this actually look like in practice? Let's pivot from these broad concepts down to the actual difficult choices happening on the manufacturing floor every single day. Let's unpack these deliberately because, honestly, these aren't just rules slapped on a break room poster. These are conscious, tough choices. First up, recording data exactly as it happened, not as it was supposed to happen on the schedule, but the raw, unvarnished reality. Second, escalating a deviation. And let's be real here, it is almost always inconvenient. It usually happens right before a shift, totally killing your momentum. But true integrity, it means raising your hand and stopping the line anyway. Third, following approved procedures without taking shortcuts, even when skipping a 5-minute redundant check seems so much easier in the moment. Fourth, prioritizing patient safety over production pressure. When the push to deliver a batch is super intense, your integrity acts as the ultimate shield for the patient. And finally, speaking the truth, even when it's incredibly difficult to do so with your peers or to leadership. Every single point here represents a conscious choice to not take the easy way out. Ultimately, in pharmaceutical quality, every signature you write, every piece of data you enter, every investigation you conduct, and every batch disposition you make boils down to this one singular question: can this decision be trusted? It all rests on that. All right, section 3, the ultimate stakeholder. Let's zoom out for a second and think about who is actually impacted here. When we make those tough choices on the floor, when we ask ourselves if our decisions can be trusted, who is on the receiving end of that trust? We so often fall into the trap of thinking that trust is built through policies alone. Like, if we just have a thick enough binder of SOPs, trust is magically guaranteed. But that's simply not true. Look, policies are absolutely necessary. But true, unshakable trust, that is built through consistent acts of integrity. It's earned through the daily, relentless grind of principled actions, day in and day out, by every single person in the facility. So, the crucial point is this: the ultimate stakeholder, the patient, is completely blind to our internal processes. Patients may never know our names, they're never going to see our signatures on the batch records, or hear about that deviation you escalated on a Friday afternoon. But they place their ultimate trust, and honestly often their very lives, in every medicine we manufacture. And that profound trust, that is earned right there on the floor long before the product ever reaches a pharmacy shelf or a hospital bed. Which brings us to section 4. Compliance versus character. This is the ultimate juxtaposition. Now, what's really interesting about this slide is the profound distinction it makes between a functioning pharmaceutical facility and an exceptional one. Notice the difference here. Compliance is measured by compliance, but integrity is measured by character. You can look at a checklist, you can review an audit, and you can definitively measure if a process is compliant, right? It's totally objective. But character is what drives a person to adhere to that compliance when absolutely no one is holding the checklist. It's the difference between doing something because you have to and doing something because it is fundamentally the right thing to do. Passing a checklist is compliance, but possessing true moral character in your daily work, that is integrity. I want to leave you with this provocation. Think about your own workspace. Think about your own daily routines. What does integrity in pharmaceutical quality truly mean to you? Try to recall a time you witnessed someone making the hard choice, or maybe a time you had to make it yourself. I invite you to share one example where doing the right thing, especially when it was super inconvenient, made a lasting impact. Because honestly, it's by sharing those stories, those quiet and visible moments of character, that we truly build a culture of quality. Thank you so much for joining me for this explainer. I'm going to leave you with this one final thought. What will you do today when nobody is watching?